I'm here with Dr. Kaveh Safavi from Accenture's Global Health Practice. Kaveh, welcome to the Federal Health Revolution.
Great.
It's great to have
Jim.
you.
Thanks, Jim.
When I think about you being in medicine and leading us on a global scale, talk about how did you get into healthcare?
I actually grew up around doctors. I grew up in a family where everybody was expected to be a doctor, but some of my first role models were actually community pediatricians, rural area. And I really enjoyed watching them. They'd get up early in the morning, they'd go to the hospital, then they would go to the office and come back, and I would see them in the afternoon. They'd talk about their patients, and then all night the phone call would come in. And that just seemed to me like a job that really mattered for the people that they were serving.
But as if that wasn't enough, also a lawyer. What caused you to keep going and explore those other areas?
I really was interested in healthcare policy, and I thought at the time, this is 30 years ago, that a legal training would actually help me understand healthcare policy a little bit better. I really didn't know where that would take me.
When I think about what Accenture's doing with our technology vision, can you describe some thoughts perhaps around how do we take that aspirational view and sort of the transformative way we're thinking about the world as a business and how we're applying it to health?
Well, this year our technology vision really talks about how technology actually humanizes health industries, which is ironic because people think about technology as dehumanizing or making things less personal. And our hypothesis is that if you think of technology correctly, you actually allow yourself to create an experience that's much more on the patient's or the client or the citizen's own terms. So our first tenet in our technology vision, as an example, is AI is the new UI. So artificial intelligence is the new user interface. And here's the basic concept, which is that the way we interact with technology today is largely determined by how the technology is structured, right? To make it simple, you go look stuff up and you have to know what you want because there's no way that the technology organizes the information to make it easy for you based on what you might want in order to make that available. Our thinking, of course, is that the way we interact with technology is largely going to be smarter and more intelligent, more based on knowledge, awareness of our preferences, so that the way we interact with it will actually seem even simpler and less technical. Things like the ability to understand spoken voice, the ability to understand based on what you've done before, what you might want to do, or answers people like you. All those kind of things become part of the experience. So trying to make the technology actually more personalized rather than less personalized is one of the basic ideas.